All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, community pharmacist of the world. And so we're going to get right back into our discussion regarding COVID-19. I talked about risk factors. So these things kind of determine how well you will do if you contract the disease. So some people can't understand why there are 100-year-olds who are surviving it, and you have 15, 20, 30-year-olds who are succumbing to it. So there are a number of factors. The first factor I want to talk about are comorbidities, and these are diseases that you already have that put you at risk. So I already told you that COVID kills us by inflammation and blood clots. Well, if we already have diabetes, our pancreas is already inflamed. If we have cardiovascular disease in our heart, then we already have an organ that's compromised. If we have asthma, COPD, emphysema, then we already have inflammation and disease going on in our lungs. So what COVID-19 is, it is an opportunist that takes whatever disease you have and it speeds it up and makes it worse. That's pretty much the best way to describe it. So it winds up, I guess pretty much causing organ failure. So you got to think about it. If you have pneumonia, your lungs are failing, they're filled with fluid, they're filled with blood clots, and think hyaluronic acid is what they're saying that forms in there, and inflammation. And so they're failing. The air can't get through. You think about your heart. It can't push through the blood because there are blood clots in the way, because there's inflammation. And so the vasculature can't traverse the blood the way it needs to. Same thing with the pancreas, that it can't kick out insulin to deal with that high spiking blood sugar. Liver too, we got liver and testes. And so regarding testicles, I think long term we're going to find out that this thing is going to cause sterility in men because we still don't understand the effects. People have gotten sick from it, they've recovered, but they're still having after effects. And that's the thing with it. So while the virus itself may have been shed, it still causes disease progression in terms of your heart, your liver, your lungs, whatever. All right, so comorbidity, that's one factor. Your second factor, based on research out of China, was your ethnicity. Now, when we first looked at the course of the disease in China, the Chinese did basically an ethnicity study, and they found that by and large the strain, the B strain which infected China, A strain is here, is that they found that Asian men had more proclivity to catching and succumbing to the virus. After that, white men, and then African men. So we don't fully understand that, but my hypothesis is that because you have a population that smokes heavily, their lungs are already compromised, and then you know that China's atmosphere or environment, because of the industrialization, is already smoggy and unclean. So I think that because the lungs were already compromised, that's why it was easy for a lot of them to succumb to the pneumonia piece. The other one, and which is very intriguing, by the way, is your blood type. So your blood type determines whether or not you catch some of the complications or sequelae of COVID-19. So remember, I talked about inflammation and blood clots. So it appears that the blood types most likely to have issues with inflammation, are going to be your type A's, B's, and AB's. Your O blood types will not have as much inflammation going on by immune response, and that comes through your myeloid immune. You have two types of immunity. You have lymphoid and myeloid. So myeloid is where that cytokine storm comes from, tumor necrosis factor alpha and interleukin, blah blah blah, and then the lymphoid is what produces our antibodies. So in type A, B, and B, the myeloid immunity is really ramped up. And so the body pushes it out, it recognizes it. In type O's, you don't get such a cascade. The other piece is, so we've gone from inflammation. Now we're going to talk about blood clots. The blood types who have proclivity to developing blood clots are, again, type A, type B, and type AB. O, not so much. Well, Dr. Pruitt, that is hogwash, and I don't believe that. How could it possibly be that O people just do not clot like others? Well, here is why. Because those of you who are blood type O negative and O positive out there, you have a deficiency in something called von Willebrand factor. And what von Willebrand factor is, it is a protein that circulates through the blood, and what it does is it carries platelets with it. You also have a shortage in something called factor 8, which is a clotting protein produced by the liver. So type O's have a deficiency in these two that are normally supposed to go where there is injury or inflammation somewhere. They take the platelets and they take the clotting factors and they patch that area up, or they create blockage there. This does not take place in type O's, and so this is why those of you who are O have kind of survived a little bit better. Now, all of this kind of goes out the window if you're an O and you have comorbidities. Factoring in perfect health, your O's, you're probably going to shed this thing if you even contract it. The O's are probably your people who are asymptomatic, just because they're not going to get that ramped up myeloid response, which results in a cytokine storm. But they also won't develop the blood clots either. So I'm sure that if we do the research, we'll say the majority of the people who are asymptomatic were probably type O. Okay, so that is your risk factor. Now, you probably wonder why the numbers seem to increase in some states like Florida and Texas and Cali. It's because there's a new sheriff in town, and this new sheriff is a new strain. It is called D614G. So I think the previous strain may have been like D614D, but there was one molecule that it mutated and changed. Weird, huh? Almost like it was programmed to do that. All right, so what is the difference in between D614G and the old strain? Well, in the old strain, you got the inflammation piece, the spikes, most of them, some of them were not active and some were active. So if you happen to catch one that's active, and the only way that it could get in is through that ACE2 receptor, so ACE2 receptor in your kidney, your lung, your heart, your brain, then the old strain could get in, and that's the only way it could get in. This new strain, it can get in anywhere. So it goes through ACE2. If it finds a T cell, one of your immune system cells, it can get in there. It can get into your peripheral tissues. And why is that, Dr. Pruitt? And that is because there has been, with this mutation, there's a 10-fold increase in spikes. So whereas it used to look like that, now it looks like this. And with all of those more activated spikes, it has more places to infect and touch and get into your cells and and into your body and replicate itself. And once it gets in there and replicates itself, it's causing all kinds of damage. It's causing inflammation. It's causing clots. So remember, if nothing else, inflammation and clots is how it gets us. So we want to decrease our risk for those. The other way by which this mutant strain is different is that normally with a virus, you'll catch it, you'll elicit an immune response, maybe produce some antibodies, and then your body will recognize it. So those of you who've been donating your plasma and now we're able to use convalescent plasma, which means this is the plasma from people who've recovered. They elicited an immune antibody response, their antibodies killed off the virus and remembers it. So for those people who were really having a tough time in the hospital and could not make antibodies to this thing, they were given the antibodies from someone who survived it, and they were able to beat the virus. So this new strain, yeah, it's something else. What it does is it ramps up the myeloid immunity. So it ramps up your tumor necrosis factor, your inflammatory stuff, all the destructive parts of your immune system, and it sends your immune system in hyperdrive. So you're thinking about your lungs, being inflamed, your heart being inflamed. Inflammation is the body trying to kill something strange. So it notices something strange, but it overdoes it. It goes into hyperdrive. The other thing that it does is it shuts off your ability to make antibodies. That's right. So whereas normally, if your body comes in contact with something, you can make antibodies to it, produce immune response, and it can kill it off. This new strain appears to shut off the body's ability to make antibodies to kill it off. So this is this is really strange, that a mutation, it's almost like this thing knows how you beat it the first time, and it mutates, figures that out, and shuts off that immune system cascade. So D614G, very scary. You all stay right there. We'll be right back.